Ladies and gentlemen, welcome to WHN. This is your host, Dr. Yavuz Selim Salai. I really am excited and thrilled to share the best news and the most authentic news about health with my 500 million viewers all over Africa. Our first news is about to drive down the insulin prices, which is an amazing news. World Health Organization will certify generic versions of insulin. Our second news is about sleep. Many of you may have sleep problems. Irregular sleep may increase risk of cardiovascular problems. Did you know that? Our third one is about fatigue. Do you know actually what causes fatigue and how can actually we treat fatigue? Our fourth news is about the coronavirus crisis. The coronavirus crisis is actually a very important one, which many of you are unfortunately seeing the problem. And in this problem, we will teach you how to master washing your hand in 20 seconds. Because many of us are actually washing our hands less than 20 seconds. So how to master it during this crisis is very important. Our fifth news is about the coronavirus crisis as well. World Health Official says that coronavirus containment remains possible. Let's get to our first news. To drive down insulin prices, World Health Organization will certify generic versions. About 80 million people with diabetes around the world need the hormone, and half of them unfortunately can't afford it. Creating competition could help, the agency said. With insulin prices skyrocketing and substantial shortages developing in poorer countries, the World Health Organization said that it will begin testing and approving generic versions of the drug. Agency officials said they hope to drive down insulin prices by encouraging makers of generic drugs to enter the market, increasing competition. At the moment, the world's insulin market is dominated by three companies, Eli Lilly, Novo Nordisk, and Sanofi, and they have steadily pushed up prices for the last 2 decades. 400 million people are living with diabetes. The amount of insulin available is too low, and the price is too high. So we really need to do something. Emmer Cook, the World Health Organization's head of regulation, has mentioned. And he also is responsible of the regulation of medicines and health technologies. The approval process, which the World Health Organization calls pre-qualification, will permit United Nations agencies and medical charities like Doctors Without Borders to buy approved generic versions of insulin, and this process also will reassure countries without strong regulatory agencies the approved drugs are safe for their health ministries to purchase. The World Health Organization aims to duplicate its success in widening global access to HIV drugs, started in 2002. Pre-qualification helped rapidly lower the prices of the medications in poor and middle-income countries. At that time, nearly 7,000 Africans were dying of AIDS every day because they could not afford HIV medications, for which Western drug companies charged up to $15,000 a year. Now the drugs are made in India, China, and other countries, including Turkey, with thriving generics industries, and they cost less than $75 a year. About 80% of the people in the world taking HIV drugs are taking inexpensive generics tested and approved by the World Health Organization. The crisis now facing people with diabetes is equally important and dire, ladies and gentlemen. Over the last 35 years, the number of people in the world with diabetes had quadrupled to 400 million, said Dr. Goshka Roklik, the World Health Organization's chief of diabetes management guidelines. People with uncontrolled diabetes face premature death, blindness, stroke, foot amputation, and other consequences of dangerously high blood sugar levels. The increase in diabetes is unfortunately partly the result of the population growth and rising life expectancy. But mostly it is driven by the obesity epidemic and lack of exercise, which contribute to type 2 diabetes. And this typically begins in childhood and destroys the body's ability to make insulin. And also, this has been increased by about 10% a year for unknown reasons, says Dr. Rocklick. So even though insulin has been on World Health Organization's essential medicines list for over 40 years, about half of those 80 million people cannot get the insulin they need because they or their country's health systems cannot afford it, the World Health Organization said. In the United States, where the price of a vial has risen to $275 from $35 over 2 decades, diabetics without good health insurance are forced to ration whatever they can afford or to buy insulin on the black market. Drug companies making insulin for domestic use exist in India, China, Poland, Ukraine, United Arab Emirates, Brazil, Mexico, Turkey, and Russia. Several have already expressed interest in entering the global market if they can win World Health Organization approval. UNICEF, the United Nations Development Programme, and Doctors Without Borders have all said they would be likely to buy insulin from World Health Organization certified suppliers. They have been waiting for this for a long time, said Krista Capuch, the pharmacist coordinator of the Access to Medicines campaign at Doctors Without Borders. Novo Nordisk welcomes the new pre-qualification program, which reflects an increased focus on diabetes by the World Health Organization. A company spokesman, Ken Inchausti, said. Novo Nordisk is committed to be part of the solution. Nicholas Craftsman, a Sanofi representative, said he had not heard of the World Health Organization plan, but added they definitely support any solution that makes access easier for their patients. Kelly Murphy, an Eli Lilly spokesman, said any program that makes access to insulin easier for people is important. In a recent World Health Organization survey of 24 countries, most of which were poor or middle income, 40% of healthcare facilities had no insulin on hand. In some countries, the price of a vial in private pharmacies was 15 to 20% of a typical worker's take-home pay. Noting that Americans also struggle to afford insulin, Mrs. Cook speculated that her agency could spur the entry of generics into the American market by working with the Food and Drug Administration to raise confidence in products they had approved. But the health agency's move is unlikely to immediately affect the sky-high price of the hormone in the United States. The American market is regulated by the FDA, and merely applying for approval is prohibitively expensive for many small companies. Insulin was discovered almost 100 years ago, ladies and gentlemen. The drug itself is not patented, although different ways to make and deliver it are patented. In the United States, established pharmaceutical companies often file suits claiming patent violations to drive generic competitors out of the marketplace. Still, Americans are increasingly aware that virtually every country in the world pays less for medicine, a realization that has set off congressional hearings and become a rallying cry for presidential candidates. In July, for example, Bernie Sanders took a group of Americans with diabetes to Canada to buy insulin, saying that corporate greed had made the price in this country almost 10 times higher than the price in Canada. President Trump has said he will lower drug prices, though a plan to do so has not yet been enacted. The director of the Affordable Insulin Now campaign, Rosemary Enobecker, on Wednesday called the World Health Organization announcement a good first step toward affordable insulin for all around the world, but said it would not help the 30 million people with diabetes in the United States and also a much higher number of people around the world. Any measure to lower American prices must require Congress to grant Medicare the power to negotiate drug prices, she added. Ms. Cook said cheaper insulins could be on the market within 2 years. A meeting of all the world's insulin manufacturers planned, and also it will take time for each to submit data showing how they make and test their products. The World Health Organization inspection and approval process currently takes about 9 months. Insulin, which is a hormone typically grown in E. coli bacteria or yeast, is more complex to produce than, for example, HIV drugs, which are laboratory sensitized chemicals. But Ms. Cook said she expected no problems with testing different companies' versions and certifying them as safe and effective. The World Health Organization has already begun a program looking at monoclonal antibodies used to treat cancer. Confirming that different versions are biologically similar is more complex than insulin, she said. Our second news is about sleep. I know many of you have difficulty sleeping, and unfortunately I have bad news for you, because irregular sleep may increase risk of cardiovascular problems. It is not just a lack of sufficient sleep that affects a person's health, ladies and gentlemen. A new study suggests having irregular sleeping patterns may contribute to the risk of cardiovascular problems, according to recent evidence. Having irregular sleep patterns may interfere with cardiovascular health, a new study suggests. Scientists already know that sleep is of utmost importance to health. Research has shown that without sufficient sleep, pretty much every aspect of health is affected, from cognitive functioning to immunity. But even people who sleep for a good number of hours each night may face still increased risk of their health if their sleep is irregular. That is, if the hours they sleep vary wildly from night to night, or if their bedtime and wake-up times change a lot. A new study by researchers from Brigham and Women's Hospital in Boston, Massachusetts, has found that people who have very irregular sleep patterns are more likely to experience cardiovascular events than those with more regular sleep. The study's authors report their findings in the Journal of the American College of Cardiology and stress the importance of good sleep hygiene. When we talk about interventions to prevent heart attacks and stroke, we focus on diet and exercise, notes lead author Tianyi Huang. He continues, even when we talk about sleep, we tend to focus on duration, how many hours a person sleeps each night, but not on sleep irregularity and the impact of going to bed at different times or sleeping different amounts from night to night. This study, ladies and gentlemen, indicates that healthy sleep isn't just about the quantity, but also about the variability, and this can have an important effect on your heart health. Our third news is about fatigue. Do you actually know what causes fatigue? And do you have any idea how to treat fatigue? Fatigue is a common problem involving a physical and mental state of being extremely tired. Physical and mental fatigue are different, but they often occur together. Long-term physical exhaustion can also lead to mental fatigue. Poor sleep can lead to fatigue if ongoing. And according to the CDC, 1 in 3 Americans say they do not get enough sleep. And the National Heart, Lung, and Blood Institute recommend sleeping 7 to 8 hours a day for adults over 18 years of age. Poor sleep is associated with a variety of medical problems and health conditions. These include diabetes, high blood pressure, heart disease, obesity, depression. Lack of sleep can also prevent a person from fulfilling their usual tasks. It can make it hard to get out of bed in the morning. When it affects safety, for example, on the road, it becomes a public health concern. In severe cases, a person may show signs similar to that of an intoxicated state. Here are some key points I want to share with you, ladies and gentlemen, about the fatigue. Fatigue can be due to a variety of medical conditions and health problems. Some causes include anemia, thyroid conditions, diabetes, lung and heart disease, and having recently given birth. If a health condition such as diabetes is diagnosed and properly managed, the fatigue actually may go immediately away. A healthful diet and regular physical activity can help reduce fatigue for many people. For more detail, and if you are suffering fatigue, please go to your doctor and make sure you have a checkup. Our fourth news is something very simple for many of you. It's about washing your hands. The question, because of the coronavirus crisis, do actually all of us wash our hands properly? And do we wash our hands long enough? Today, I will talk about how to master the 20-second hand wash. You have probably heard of a Jillian times by now. One of the best ways to prevent infection from the new coronavirus is to wash your hands to get rid of any pathogens you may have picked up. The thing is, many people don't wash their hands correctly. We have to face this fact. That's why I made this a specific news for all of us. Even if it sounds simple, many of us are actually, they think 10 seconds is enough. Nope. You may just be able to rub a little soap between the palms and ignore the other parts of your hand. And if you do a slipshod job, the coronavirus pathogens will still be on your hands when you're done. And if you touch your hands to your face, as humans do about 200 times a day, those pathogens can infect you via eyes, nose, or mouth. So it doesn't matter whether the water is warm or cold. The United States Centers for Disease Control and Prevention explains on its website. And antibacterial soap works just as well as regular soap. But running water is the key, since standing water could be contaminated, ladies and gentlemen. You need to clean the areas between your fingers as well as your thumb and the backs of your hand. Dr. Mark Gendrew, the chief medical officer at Beverly Hospital in Massachusetts, mentioned. So scratch your palms in order to scrub the fingertips and to get some soap under the initial part of the nail, he adds. So ladies and gentlemen, please promise me from now on, you're not gonna rush. This is no joke. Just 10 seconds under water is not enough. We have to make sure We are really doing a proper job in washing our hands with soap at least 20 seconds. Thank you for listening to World Health News. Our last news is about the coronavirus crisis. The World Health official says despite all the challenges, coronavirus containment remains possible. As long as you have these discrete outbreaks, there is the opportunity to control them, says Dr. Bruce Aylward, the team leader of the joint mission between the World Health Organization and China on COVID-19. Even as the number of new coronavirus, ladies and gentlemen, continues to spiral upward in countries around the world, a top global health expert says it's not too late to contain the virus. As long as you have these discrete outbreaks, there is the opportunity to control them, to get on top of these and contain them and prevent a lot of disease and ultimately death, says Dr. Bruce Aylward, a senior advisor to the Director General of the World Health Organization. That's the big message we saw in China and one of the big surprises. Aylward led a fact-finding trip in China in February on behalf of the World Health Organization. He says the experience there altered his view of what can be done. They actually changed the course of a respiratory-borne outbreak without a vaccine, which was extraordinary, says Aylward. The number of daily new cases in China went from around 2,000 just a few weeks ago to less than 100 in recent days. But Aylward says other countries may be taking the wrong lesson from China by attributing its success to the government's unprecedented restrictions on daily life in several cities, most famously Wuhan, the city of 11 million people, where the outbreak began. There, the government has suspended transportation out of the city and for the most part required people to remain in their homes, with only brief forays permitted to stock up on food and other supplies.
China's government has ordered a lockdown on Jia County in Henan province. It borders Hubei, which was the epicenter of the coronavirus outbreak in China. 600,000 people have been ordered not to leave their homes unless they have official permission. The order came after an infected man came into contact with 2 doctors who then tested positive. The new lockdown has sparked fears of a second wave of infection, just as China is restarting the world's second biggest economy after months of enforced quarantine. China's foreign ministry says US officials are shameless for accusing Beijing of covering up the true picture of the outbreak. A ministry spokeswoman accused the Americans of politicizing a health issue.
We have said multiple times that slanders, smears, and finger-pointing cannot make up for the lost time. They'll only cause more lost time and lives if they continue to lie.
Just like China did at the start of the epidemic, many countries in the region have imposed tough restrictions on movement. Malaysia is reporting early signs of a slowdown in the infection rate, but the government says strict control measures need to be adhered to. The president of the Philippines has ordered soldiers and police to shoot anyone who violates the mandatory month-long lockdown. Rodrigo Duterte issued the warning after a protest by residents in a poor area of Manila complaining about the lack of food and government aid.
My orders are to the police and military, also with the village officials. If there are troubles or occasions where there's violence and your lives are in danger,
shoot them dead.
Rights groups have criticized his remarks, with Amnesty International calling them heartless and unjustifiable.
Ladies and gentlemen, China has 31 provinces, thousands of cities, and it was only a few cities where they took those draconian measures. In the vast majority of them, they really went back of fundamentals of public health. These included ensuring that there was enough testing capacity to quickly identify cases, isolating infected patients, tracing anyone who had contact with them, and when necessary, placing those contacts in quarantine facilities so they wouldn't get infected by the sick person or spread the disease further. Also, in places where clusters of cases were emerging, authorities prohibited mass gatherings. That's how they stopped it in the areas with over 1.3 billion people. So Mr. Aylward spent about 2 weeks over there on the ground looking at the data. And every other province beyond Hubei, where Wuhan is located, had hundreds, if not thousands of cases, not unlike the situation you see in European countries or in the US. These are massive provinces with tens and even 100 million people in them. In short, Aylward says it wasn't a lockdown everywhere. That's the wrong way to portray China's approach to the disease. And that's leading to some fundamental confusion and failure to do the right things. So is Italy's decision to impose severe lockdown, like restrictions in vast swaths of its northern region, the right approach? Aylward said he is reluctant to comment specifically on Italy's decision because he is not familiar with the epidemiological data there. One of the challenges with Italy right now is just the amount of data. He says they are just running so fast to catch up with the cases, it's difficult to understand what's driving the transmission, because that's what you want to use to drive your strategy, what you cancel, what you suspend, etc. It should be driven by the way the virus is moving. Still, Aylward says there is indeed a threshold where it becomes necessary to impose major restrictions on movement. That happens when there is substantial community-level transmission, where it's spreading in so many different environments, you can't even differentiate clusters. That's what occurred in Wuhan, China. But even in those instances, says Aylward, it's crucial not to rely on restrictions of movement as the sole remedy. Public health authorities need to be prepared for a rebound in cases when movement restrictions are lifted and cases start to tick up again. So when he talked to governors of provinces in China, mayors of cities, and asked them, what are you doing now? They say we're building beds for isolation and we're buying ventilators to help take care of the very sick, Aylward says. And the interesting thing is, you are seeing falling disease in these massive provinces in China, and they are building capacity. Meanwhile, he adds, in Europe and United States, authorities are still struggling to manage far fewer cases. I mean, it's a completely different willingness to properly prepare. How have delays in coronavirus testing affected the ability of the United States to get ready? Well, it complicates their response, says Aylward. And he mentions also, we are where we are. The important thing is looking forward. You have seen this disease's potential to spread for weeks, and you need plans to be able to isolate dozens, if not hundreds of people, to be able to trace many contacts. And you have to be able to test. Even if it's not possible to fully stop the spread, he says, you can still slow it down and protect the vulnerable populations and limit the amount of damage that this disease can do. Ladies and gentlemen, this is World Health News. I'm your host, Dr. Selim Sulay. I wish you a healthy rest of the week. Take care and all the best.